I think San Antonio this year is going to be a very exciting meeting. First, the organizers have created a series of very nice talks that really, I think, will give the participant a great understanding of where research is right now in a variety of areas. In breast cancer, we have some fabulous speakers and topics. In terms of the research studies, obviously the poster discussions are very useful because there's a lot of opportunity for interaction and discussion. But in terms of the plenary platform presentations, there'll be a number of talks talking about hormone receptor positive disease and reversing resistance with novel agents like a cyclin-dependent kinase inhibitor, a bevacizumab European trial called the LEA trial, looking at whether bevacizumab adds to first-line aromatase inhibitor therapy for metastatic disease. And then there's going to be a number of different marker studies looking at ways to try and predict response and resistance. There's also an international consortium that are trying to standardize the testing tool Ki-67, a marker of proliferation, and that will be presented as well, which I think will be interesting. In terms of HER2 positive disease, we're going to see some interesting data on biomarkers in the Cleopatra trial, the trial with pertuzumab in the metastatic setting. We also are going to see an analysis of immune markers and whether or not that could be useful in predicting response to neoadjuvant pertuzumab from the NeoSphere trial. And there will be data, which I think is very important to us, about duration of adjuvant trastuzumab, the 1 versus 2 year data from the HERA trial, and a trial looking at 6 versus 12 months called the FAIR trial, both of which had data presented at the European ESMO meeting in September of this year. And then there will be data looking at radiation therapy trials, this update of the START trial, some data looking at sentinel nodes, and then a very interesting combination of different groups that have looked at the use of systemic therapy after local regional recurrence and whether or not we can improve outcome by administering systemic therapy at that time, which I think will be very interesting and will impact clinical practice. And then, of course, not to be missed are the summary talks, which occur on Saturday as the last day of San Antonio, that talk about basically what was hot over the course of the year and where we're going in the future. And I think those talks are always excellent.